Yes. Go and check it.
I'm checking on my phone.
Is it working? Yes. Go and check it.
I'm checking on my phone.
Okay, guys, whoever is next should make their way.
Begin.
Oh. 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 Oh.
Hello.
Oh.
Hello, I'm Sadi. I'm one of the junior doctors here in this department. Can I confirm if you're Mr. Newton?
Oh.
Yes, I am.
Okay. Can you please confirm your age for me?
Oh. Oh.
Mr. Newton, I can see you're in a lot of pain. We're going to help you.
67 years old.
Alright, thank you for that. So,
Oh.
can you please tell me?
Oh.
Can you please tell me what's going on?
Oh. Oh, I've had the pain for a couple of hours now.
And can you please tell me how it started?
It's just started suddenly.
Alright, and is there anything apart from the pain that's bothering you, Mr. Newton?
Oh. Oh. No, I've never had pain like this before.
Alright, and can you tell me where exactly is the pain?
I'm feeling it in my right leg.
Alright, okay, and can you please tell me
Oh.
if you have pain anywhere else in your body?
Oh.
Maybe
No.
Okay, can you tell me if you have any known medical conditions? I'd like to
Not that
attach
I
the
know.
monitor. Okay, so his respiratory, Mr. Newton, I'm just going to see your vitals for a minute. Your respiratory rate seems fine. Sorry, your oxygen saturation seems fine, and your respiratory rate is. Okay, Mr. Newton.
Yeah.
Okay. I'm just going to quickly examine your chest. Do you have any pain in your chest?
Oh. No.
I'm just going to slightly tap on your chest now.
Normal notes.
Okay. And can you please take a deep breath for me?
Oh. Oh. Oh.
Thank you. Again, please.
Oh.
Normal lung sounds.
Alright, so your respiratory rate is a bit high and your oxygen saturation is normal. And just to make you comfortable, I'm going to give you some oxygen. Is that okay, Mr. Newton?
Thank you.
Can you please tell me if you have any smoker's cough?
No.
Mr. Newton, can you tell me if you have any known medical conditions?
I have problems with my heart, but
Are you taking any medications for that?
yeah, there's some pills that I usually take, but
Oh. Oh.
Just checking for your pulses.
Oh.
Your heart rate is really high, Mr. Newton, and your blood pressure seems alright.
pulse is not filled on the right limb.
Okay. Mr. Newton, how are you feeling now?
No, I've never had pain like this before.
Okay, we're going to make you feel better. What we're going to do right now, I'm going to just check for your...
I feel really bad.
Just bear with me, Mr. Newton. We're going to help you feel better. I'm just going to check your capillary refill time by pressing on your finger.
Thank you.
Normal.
Okay. What I'm going to do now is insert 2 IV cannulas so that we can give you some pain medications and some fluids, okay?
Thank you.
Find the other one.
Azim 2.
Okay.
I'm just going to start you on some fluids because of your pulse is really high, so I'm going to give you 500 ml of warm normal saline. It's expired, but we're assuming it's not. And I'm going to take some bloods for a routine blood test, your clotting profile.
2 minutes remaining.
And I'm going to send drop eye and and I'm going to send 4 units of blood for grouping and cross matching. Mr. What's his name? Can you please tell me if you take?
I don't feel well.
Right. And I'm also going to give you some morphine, 5 mg through your veins to help you ease you with the pain.
Thank you.
What are you looking for?
Morphine.
Okay.
Assume given.
Okay. 5 mg morphine IV and do you feel any better?
Yeah. The pain is a little better, but I still feel it. It's very bad.
I feel really bad.
Right. Alright, Mr.
My leg is killing me.
Right. I'm just going to expose you a bit to examine your leg better, okay? I'm just going to check if there's any peripheral pulses are absent in the leg. I'm going to check for the color and the temperature of the right leg.
Leg is cold.
Okay. So what we're going to do, Mr. Morrison, it seems like you have some blockage in your blood vessel in your leg. So we need to take you to the we need to call a specialist in to review this because you might need surgery for this.
Okay, you can discuss the case with me right now.
Alright. So my patient, 69 years
Move on to the
old,
next station.
presented with pain in his right leg. When I came to examine him, I just started the ABCD protocol. His airway was patent because he was talking to me,
Yes.
and so I started him on 15 liters of oxygen via face mask. On breathing, his breath sound his chest was normal inspection. His breath sounds were normal. And on circulation, his pulses were absent. His radial pulses, I could not feel them. And his dorsalis pedis pulse in the right leg was absent.
His radial. Okay,
I
continue.
mean, I could not feel it at this time. Last time I was able to.
Continue.
Okay. And apart from that, he was two whiteboard cannulas were inserted, bloods were sent for investigations, and IV fluids was started, 500 ml normal saline in 15 minutes,
Okay.
and IV morphine 5 mg IV was also given.
Okay.
The patient,
What's the diagnosis?
it's atrial it's acute limb ischemia.
Yes, because the patient has what caused the acute limb ischemia?
Most probably is AFib.
Yeah, exactly.
Yeah.
So, what is the most important medication in acute limb ischemia?
That I was not able to remember.
What's the problem with the patient? What's the problem with the leg? Why is there acute limb ischemia?
There's a clot in the leg
Is
that's
there
obstructing
any way
blood
that we
flow.
can?
Heparin?
Yeah,
So
yeah,
5,000
exactly.
units of that. Okay.
Exactly.
Hmm.
So that's mostly the only thing that you've missed,
Okay.
and unfortunately, that's the important thing.
Yeah.
The most important thing that you've
Mhm.
missed. So when you've assessed the pulse, right, and then the examiner told you there is no pulse in the right leg, what just came to your mind?
That
It
there-
is
that it is acute limb ischemia.
Exactly.
There's a clot that's obstructing the flow.
exactly. The first thing that comes after that, I need to give this patient heparin.
Alright.
As the patient, the limb can go, it can die. Yes. The earlier you give the heparin, the more chances that we have to save this limb.
Okay.
So it's very important, like the first thing, whenever you feel there is absent pulsation, you say that. And there is another additional thing, okay, about acute limb ischemia, right? How do you diagnose an acute limb ischemia clinically?
Clinically.
Yeah.
We're going to examine the right limb. It's going to have absent pulses.
Yes.
It'll be cooler, and
Yes.
the color, there will be color
Yes.
changes, and what
What else? The 6 P's.
Oh, pallor, pulselessness,
Yes,
pain.
you said this, you said this, you said
Mm.
this. And then
Mm,
you said cold.
Paresthesia.
It will be cold, perishing cold. 2 missing. Sensory and motor. The actual
Okay.
function of the leg. So
Paralysis.
yeah, you already have. Most of us, we already have them. It will be cold, it will be pale.
Mhm.
There will be pain. There will be pulseless. We always forget the 2 things that the leg actually do.
Paresthesia and
Exactly,
paralysis,
it
yeah.
can feel and it can walk and it can
Mhm.
move around. So how do you say it? Could you
Could you please lift your leg up for me? Can
Exactly.
you feel me? Like I'll just touch it.
exactly to be sure that
Mhm.
this is acute limb ischemia 100%, and then give the 5. Okay, what is the dose of the heparin?
5,000 international units.
Mhm.
IV.
IV.
Yeah.
Yes, and then there is a maintenance dose.
Yeah. I don't remember. It was something in 24 hours.
Yes, 20,000 to 40,000 in 24.
hours.
Like 20, 40 in 24.
Okay.
20, 40 in 24.
Okay.
So that's the most important thing. The patient was in pain. In the available Simman scenarios, we don't have, you have post-operative pain, right? And we have the acute limb ischemia pain. That's the ones in my mind right now. Okay. He directed you from the beginning to that I have a pain in the leg.
Yes.
Good thing that you didn't jump to the leg. You continued the ABCD approach exactly, but you didn't you missed sympathizing with the patient. I'm very sorry for what you're going through. Interpersonal skills. I'm very sorry for what you're going through. I understand this can be very difficult. I'm going to give you the best care possible. I'm going to take care of you. We always reassure the patient and always sympathize. I know that it's a bit stressing, it's a bit nervous, so we are only focused to find the diagnosis and to give the best treatment possible. But it's very important because 4 marks are interpersonal skills. They are as much as important as giving the heparin.
Yes.
See that? So if you just did the interpersonal skills very well and you forgot the heparin, you might somehow pass. But heparin is actually a lethal thing to forget because the limb is going to be amputated. This man is going to live without a leg. So I want you to always remember, acute limb ischemia, 5,000 international units IV heparin.
Okay.
And in examination, an additional one to give you high marks, you examine the 6 P's.
Yes. Okay.
Yes. Other than that, you conduct the ABCD protocol very well actually, but the leg examination is stress out on it.
Okay.
Okay, that's very good.
Thank you. Would we also in this case do pupil and blood sugar?
You do. You forgot about the.
Yes, we need to do
Yes.
as much as we can depending upon the time.
Okay.
As you mentioned, the most important thing in this patient is to salvage the limb. Okay, how you can do that is by giving heparin stat 5,000 units. So what can happen if there is any delay? Okay, first of all, you will fail. Okay. Secondly, this clot will extend. Okay. So if you had just below knee, if the patient was heading to below knee amputation, now after a few minutes he will need above knee amputation. Okay. Or the patient may even die. Okay. After developing the compartment syndrome and everything. So it is the most important thing is that you start the patient on heparin, okay? And it has to be IV heparin stat, okay? If you say that 5,000 units subcutaneous, you will fail again, okay? All the medications like life-saving or the limb-saving medication, you guys need to know the exact dose and their routes, okay?
You'll never forget this, I think.
Oh, I won't.
Yeah.
Okay.
Okay,
Thank
I wish you
you.
the best luck.
Thank you.
Okay, guys, this is the next scenario. Whoever is coming, read this, please.
Dr. Roshan, is it possible after every case maybe you come and clear a few questions that we have? Yeah, because we tend to have questions, and I think they are best answered by you if, like, after a case you come back and
Yeah,
because some people thought that it's only the senior who is supposed to give heparin, which is not true.
No.
Yeah. Alright.
So everything is
Begin.
Hello. I'm Dr. Yunus. Are you Mr. Joseph? Hello. Let me check your wristband.
correct patient,
Hello, Mr. Joseph. Can you hear me?
unresponsive.
Okay. So, Mr. Joseph, let me check your airways.
Patent airway.
Okay, the airway seems to be patent. Okay, so I'm going to examine your chest, and to do that I need to expose you above the waist, and there will be a chaperone with us.
Assume none.
Okay, so
Normal chest expansion.
normal chest expansion. So I'm going to tap on your chest.
Normal sounds.
Okay, so let me hear your chest.
Normal chest sounds.
Okay, so let me have a look at the monitor. Your oxygen saturation is within normal limits, and your respiratory rate is slightly higher. So I'm going to give you oxygen at the rate of 15 liters per minute by a non-rebreather mask. Okay, so I'm also going to do a chest x-ray and an ABG. Okay, so let me feel your pulse. The pulses are palpable, and let me do the capillary refill timing.
Normal.
It's normal. So I'm going to hear your heart sounds.
Normal heart sounds.
Okay, so now I'm going to insert two large bore cannula in both of your hands. Your heart rate is normal, and your blood pressure is also within normal limits. Okay, so let me just insert the cannula. Okay, so now I'm going to expose you below the waist, and I'm going to examine your tummy. Do you feel any pain?
Normal abdominal examination.
Okay, So let me just check your genital areas. Okay.
Normal.
Okay. So I'm going to shine light in your eyes.
Pupils are sluggish.
Okay. So let me check your blood sugar.
Blood sugar is 3.2 millimoles.
Okay, so it seems that your blood sugar is a bit low. So I'm going to give you dextrose. I'm going to give you 10% glucose through your veins.
How much?
2 minutes remaining.
10% glucose.
How much milliliters?
500 ml.
Okay.
Okay. So let me check your blood sugar once again. Okay, so Mr. Smith, can you tell me what happened? Hello, Mr. Smith? Hello? Can you hear me?
I'm feeling very dizzy.
Okay. So,
I'm feeling very dizzy.
okay, since when?
I don't know what happened. Suddenly things just
Okay.
surged back out.
So, can you tell me if you have been diagnosed with any medical conditions?
I have diabetes.
Okay, and can you tell me what medication are you on?
I take insulin.
Okay. So, have you been taking your insulin as prescribed?
Yeah, I've been taking.
Okay, by any chance did you double dose or skip your meals?
I don't like food hospital, doctor. I don't like that.
Okay, I will definitely talk with the hospital management and we can change the food. So, you by any chance you skipped your meals there?
I think I didn't have my breakfast.
Oh, okay. So, we are going to admit you, we will recheck your blood sugar, but when you take this insulin, it would be advisable not to skip your meals.
Discuss the case with me.
Okay, so...
Move on to the next station.
I examined Mr. Smith. His airway was patent, but when I checked the blood sugar level, it was on the lower side. He was not responding, so I gave him dextrose and 10% glucose, after which he started responding, and the reason why he was behaving this way was because of his low blood sugar, which he missed. He didn't take his insulin after taking the meals.
And what would you like to do to him?
Okay, so first of all, I would like to admit him. I would like to send his sugar profile. I would like to send his sugar profile, and I would like to give him dextrose, and I would also like to continue monitoring him.
Okay, very good. Yeah, you did very good.
Thank you.
All good. Everything is good, but you did E before D.
Yeah.
You did exposure before disability.
Because I had already exposed the tummy area, so there was nothing much to do in the exposure area. That's why.
Yes. And just don't forget to examine the limbs,
Okay.
pulses of the limbs, to use the approach as it should be used. But actually, that's very good. Very good simulation, very good station you did. The dose of you gave 500 ml.
Yeah, I don't know what I was supposed to give because I couldn't find any. 50 ml of 10%.
You start with 20. I'm not sure about the doses about glucose, but what I can remember right now, 20 of 10% or 10 mLs of 20%.
Okay.
Right? Other than that, you did very well, and you presented the request very well. You followed the protocol. Yes, the A you did well, the B you did well, and the C you checked the pulses, you checked the capillary refill time, you checked the blood pressure. You did. It's
Forgot
already.
temperature. I forgot temperature.
Well, it's not like a fatal mistake. I mean, this is something that can pass. You're confident, yeah, and you're calm. That's very very good, especially in the Simman station. Overall, that's good. I'm actually satisfied.
Thank you.
Yeah, thank you. So should I know? I actually don't know what stations did each one of them make.
No, it's okay. Just mix it. Okay. Doesn't matter even if they're doing it again.
And is it working, the transmission?
Yes, it is working. So what we need to do is.
After they finish, they should take history. The ones who will show, right?
Okay. No, you will go with me. Don't worry.
Savior's absence. Yeah, it says disable, yeah, all the patient source. Yeah, that's the mic open. How do I open the mic between the two rooms? Transmission.
They can see it now.
Not just the
Begin.
Okay, you can come right now. You can begin the station.
Hello, good afternoon. I'm Dr. Aisha, one of the doctors in the department. Hello, Mr. Ronald.
Hello.
I've been called by the nurse because she told you're not feeling well. Can you tell me what happened?
I don't know.
Okay, I'll have a look at the monitor. Can I have the monitor connected? Okay, Mr. Ronald, can you tell me what are you feeling right now?
I'm feeling a bit dizzy. I feel dizzy.
Okay, I'll quickly have a look. I'll examine you and I'll definitely try to do something to make you feel better, alright?
Thank you.
Okay, so my patient is talking and the airway looks patent. So I'm happy that the patient's airway is patent. The patient's oxygen saturation is 97, whereas the respiratory rate is a bit higher. So I'll attach you an oxygen, Mr. Ronald. I'll give you 15 liters per minute, 100% oxygen, and you should feel better. Start to feel better in a while.
Thank you.
Okay, Mr. Ronald. So now I'd like to inspect your chest. I'll have a look at your chest. For that, I'd like to expose you above the waist.
Is you done?
Chest movements normal and symmetrical, Mr. Ronald. Alright, now I'll touch your chest to have a feel at it. Please take deep breaths for me. Okay, Mr. Ronald, now I'm going to tap at your chest.
Normal sounds.
Okay, Mr. Ronald, now I'm going to have a look at the monitor again and listen to your chest sounds. Okay, I can hear some sounds but I'm not able to appreciate it. Okay, Mr. Ronald, now I'm going to know the capillary refill time. I'll squeeze your finger.
Capillary fill time delayed, 3 seconds.
Okay, Mr. Ronald, now I'm going to feel for your pulse. I cannot feel the pulse. There's no pulse here.
Two minutes remaining.
Move on.
Okay, so Mr. Ronald, I see that you have a low blood pressure. I'm going to instill 2 large bore IV cannulas. There's only one here. And I'll take some blood investigation. I'll send your X-ray, your EBGs, your ECG, and I'll give you some fluid through your veins to help with your blood pressure.
How much fluids are you gonna give?
500 ml over 15 hours. Oh, 15 minutes, sorry. How are you feeling now, Mr. Ronald?
I still feel dizzy.
Okay, you should feel better in a while, Mr. Ronald. I'd like to check the pupils. There's no torch.
Pupils are reactive as you've done.
Okay, and the blood sugar?
Normal blood sugar.
Okay, I'd like to expose you below the waist, Mr. Ronald, to have a look at your tummy. I'll examine your tummy. For that, I'll have to touch it.
Normal abdominal examination.
I'll tap at your tummy.
normal sound.
Okay, and I'll also listen to your bowel sounds. I'll send blood for cross matching. At least 4 units of blood because I see that your pressure is not improving a lot. Okay, thank you, Mr. Ronald, for letting me examine. I'll reassess you quickly. How are you feeling, Mr. Ronald?
I'm not so well. Not so well.
Are you able to breathe fine?
Yeah, but I'm feeling dizzy. I've vomited. I've vomited blood. I think I've vomited blood.
You have vomited?
Move on to the next station.
I've just had an endoscopy about like certain something inside, and I have been vomiting, and I've been feeling dizzy.
I should have taken the history. Time's up actually. Should I have taken
Time
the
is going
history?
on. You started a bit late, so you still have a minute.
Okay. So Mr. Ronald, can you tell me what happened before you started feeling dizzy?
I was vomiting.
Okay, and can you tell me the content of the vomitus?
I don't know, but it was. I don't know. It was dark.
Okay, examiner, do we have blood? Can we ask for blood from the blood bank? I'd like to give my patient some blood. Mr. Ronald, you should feel better in a while, and I'll also like to call my senior so that he can also have a look at you and see what else can be done to make you feel better. Alright?
Okay, thank you, doctor.
Okay, thank you, Mr. Ronald.
Okay, discuss the case. Discuss the case with me.
Okay. So my patient, Mr. Ronald, 67 years old, had come with nausea and vomiting to the hospital. He had an upper GI endoscopy in the morning and he was vomiting blood. So that's why he was hypotensive and tachycardic as well. So I gave him 500 ml of saline, 0.9% saline, over 15 minutes, and then I gave him some oxygen because his respiratory rate was on the higher side, and I gave him a unit of blood to improve his blood pressure.
And what will you do to the patient?
Ideally, I would like
after stabilizing the patient.
After stabilizing the patient, call in my senior, and we'd like to re-explore because probably because of the instrumentation, he's having this loss of blood, and yes, we'd correct that.
Okay, so we'll admit him to the theatre.
Admit him and take him back to the theatre.
Re-explore.
Yes.
Okay, very good. You did good. Overall, it was good. You entered. You asked the patient what was wrong, and always use the history because you know that the patient has vomited blood. Right. So there is no much point in asking him what exactly happened. He feels unwell, and he vomited blood. You see his blood pressure is low, so you.
But he has had the endoscopy, so shouldn't he be well after that?
He is vomiting blood.
It does not say that after the endoscopy also he's vomiting.
It doesn't say.
He had nausea, vomiting, and then he had the endoscopy. So then I was supposed to ask that what happened. Why is he feeling dizzy?
It's not that obvious in the
Yeah,
scenario. When did he?
Yeah, the timeline is not clear.
Exactly. So what are we gonna suspect? They didn't clear the timeline. The case is a bit vague, right?
Yeah.
But there is patient vomiting blood, and there is an upper GI, and then the patient is unwell.
Right.
So you don't know what exactly happened. So you did well. You approached the patient. You assist the airway well. The patient is talking to the airway patient. You interacted with the monitor and you put the monitor on, so that was good as well. Your breathing assessment was good. You forgot about ABG and chest X-ray.
I said that in C because I forgot that in B.
Okay. In B, you did the capillary fill time. Overall, it was good. Now, the thing is, you gave 500 milliliters fluid challenge.
I could have repeated.
Exactly. And don't wait for a response. Like, I'm gonna give you 500 milliliters of normal saline, and the blood arrival was delayed.
Okay.
You asked for the blood after you have done the D or the E.
Yeah.
Yes, exactly.
Yes.
So whenever you see a bleeding scenario,
Yes.
they're not very much,
Right.
and the patient is the circulation is compromised.
Mm.
First thing that comes into your mind that the patient has lost blood. We need to replace
The blood.
this
yes.
blood. Exactly.
Mm.
You said the investigations very well. You felt the pulsations. The radial pulsations were filled. There will be no reason for them to not to be filled. And if you're confused, just
But I couldn't feel them. I was like, it comes over here that if we can feel them or not. I
yeah,
couldn't
it
feel
came
them.
that you're feeling the right position and they can be filled. But sometimes because of the pressure, do not apply too much pressure on it. Just a gentle pressure
Maybe
because
because of anxiety, I was pressing it hard.
yes, so you block the.
Right.
Overall was good. You did about the disability.
Hmm.
You did the blood sugar. You did the eye.
Temperature, honest temperature.
But yes, but in that scenario, it's not.
Very important.
Well, the patient is yes because there is a bleeding history. So most importantly, we want to do the C very good. When we have to pass like in every scenario. You use the history. If the history tells you a clue that the patient was bleeding, if he was bleeding, if he is bleeding, if he will
I
be
understood
bleeding.
it was an upper GI bleed, but I got confused that he has had the endoscopy. So now what? I thought it
But
was maybe
he's
something
now
different.
feeling unwell.
Yeah, he's now.
He
unwell.
bled. He was vomiting bloods and he had upper
The
GI
endoscopy,
bleeding.
yeah.
Now he's feeling unwell, regardless of the
That's how I started,
chronologically.
that I've been
Yeah,
confused.
he might have had internal bleed and he's now
Yeah.
like having internal bleed and he's having melena,
Yeah.
but it's not apparent yet. It's not
Yeah.
apparent yet, right?
The abdominal examination was normal. Otherwise, there would have been some problem with that. It was bleeding internally.
Sometimes there isn't
No.
just pain, yeah.
Okay.
There is just the picture of hypovolemic shock,
Okay.
right? Other from that, you did well. You did very well. The point that you've missed, so you just benefit from what we're saying.
Investigations in B and blood in C.
Exactly. 4 units of O negative blood, and you did the group and matching, and the fluids. You gave 500 milliliters, and you should repeat the 500 milliliters. You like that. I see that your blood pressure is low, and the nurses have told me that you've been vomiting blood, and you can
Yeah.
actually do that because that's
Okay.
your history. You
Mm.
have it. It's
Right.
not like, yes. So the nurses have told me that you've vomited blood and you've just recently had an upper GI endoscopy. So and your blood pressure is low. I'm suspecting you might have an internal bleed. That's how you build an IPI, is the IPS with the patient. I'm suspecting that you might have an internal bleed. I'm going to help you with that. I'm going to give you 500 mLs of normal saline, of normal fluid,
Yeah.
to help restore the blood that you've been losing, right? And then you move to D. I'm going to assess your pupils. Mr. Brown, can you hear me? Can you talk to me? Yes, I can. So the patient is alert. I'm going to assess for blood sugar. I'm going to reassess his blood pressure. Not yet improved. I'm going to hang another 500, yes, and prepare for O negative, for 4 units of O negative blood until cross matching has arrived. Then you approach the examiner. Actually, you can actually approach the examiner. When you approach, like when you did approach me, I gave you the blood immediately, and when you take the blood immediately, you hang the blood. Yes. So that's the A, B, C.
What about the presentation? We are not supposed to repeat. I think that wastes time. Like I repeated my patient, his age, and he had an upper GI endoscopy, and now he's vomiting blood.
You mean when you discuss it with the examiner?
Yeah.
You have to, when you discuss it with the examiner, you're actually referring the case with, you have to say the situation that the patient came. You start with the situation.
Right.
The patient came, low blood pressure.
Yeah.
Yes, that's how you present the case essentially.
Yes.
Low blood pressure, normal oxygen, normal high heart rate, and the background of the patient. He has just had an upper GI endoscopy, and there is
Can you say,
history
like
of
I said, he
vomiting
was
blood.
hypotensive, tachycardic.
Yes, you can do so. Yeah, basically because you're talking to a doctor, so you can do that. He's 70 years old, or the age of the patient, and the background. He just had an upper GI endoscopy, and he has been vomiting blood. And then what did you do for the patient?
Right.
I gave him 1 liter of normal saline, and I gave him 2 units of O negative blood, and I called for the general surgery team because he needs to be readmitted immediately.
General surgery or gastro?
General can do gastro. General can subspecialize in gastro. Makes no difference. But general surgery is correct, but gastrointestinal surgery, that's what you mean, GIT surgery?
Yeah, I feel that they are the ones who do the endoscopy and...
Yes, but you mean you mean the... Without confusion, the patient needs to be readmitted to the theater.
Yeah, that's it. No, I gave a mock earlier at someplace else. So in the limb ischemia Simman, they said that I told them that I'll call the surgeon. So they said it's really important to mention which surgeon. So I said vascular surgeon.
So the patient would need re-exploration. That is done by surgeons, as far as I know. That is done by surgeons.
Okay.
Upper GI, you mean the tropical, the tropical doctors? We can discuss that with Dr. Rashad. We can discuss this point specifically, which one to call in an upper GI. However, that's all that you need. But overall, you did well. In this one, you get a pass.
Okay.
Yeah.
Do I sound really anxious?
You don't sound anxious, but I need you to work on the IPS more.
Like?
I'm hearing. So I told you normal sounds. Your chest sounds is normal. There is normal air entry in your chest. That is good, Mr. Smith. I am continuing my assessment. I can see that your blood pressure is low, Mr. Smith. I am going to give you 500 milliliters so I can improve this your blood pressure. And all the way, how are you
Breath
feeling?
sounds were normal. I didn't come in because I couldn't understand.
They were
a lot
normal.
of sounds.
Yes, but they were normal, and you can actually see see the abnormal ones.
I heard the abnormal ones yesterday, but over here I couldn't understand if this, because the normal sound is so clear, but over here there was so much.
Yes, that's a mechanical sound of the bag inflating, but an abnormal sound would be very apparent.
This is an abnormal sound.
What about this?
This is a wheeze.
Yes. This.
These are crackles.
Examine the whole lung. No, from side to
Yeah,
side.
this and this.
Yeah.
Basal crepitations.
Okay, what about this one?
What is this? This is a stridor?
This is basal crepitation.
This one was crepitation.
The previous one was normal.
Okay, again, once again, the stridor. No. What? Crepitations once again. And the normal one?
You can notice the difference.
A lot of extra sound along with it. It's very difficult.
I know,
over here.
I know, but the history will help you,
Yeah.
right? If there is crepitations, you might, most probably, you might find something wrong with the heart sounds. Might find some history of heart disease. Do not confuse yourself. If there is no history of heart disease, if there is no the
Over
blood
here
pressure
the
is good.
ECG was normal. I was trying to find anything wrong with the ECG.
Exactly. ECG normal, there is no problem with the heart. Do not confuse. Even if you can, because it is normal, but because because of the mechanical sound of the Simman, it's not as a human would sound. You know, so do not confuse yourself. If all the evidence are going suggesting that there is nothing wrong with breathing, Just say normal. Yeah, because I know some people that got confused with the sound. They said that there is wheezes, and it was just
No, wheezing
normal
is
sound.
clear. Wheezing is very clear.
Crepitations, sorry. They said
Yeah.
that there were crepitations,
Yeah.
and they were just normal. So if there is,
Even
and
in
the
normal,
case
there's a lot of
essentially, the
pain.
case essentially was post-operative pain, right? And then you listen to the chest and you hear crepitations.
It
So
should be
you're
normal.
confused. Yes, it should be normal, but it's not actually crepitations. It's the normal sound of the Simman breathing, right? And the oxygen saturation is actually good.
But the respiratory rate was 20.
Yes, because the patient is hypovolemic, so the patient is distressed. The respiratory rate is 20, but
We
not
can
very
give-
high.
not
Not
very high,
like
but we can give or no
what?
oxygen.
We always go give more. If 20, you give oxygen.
Yeah.
Most critically ill patients give oxygen. As we mentioned in the morning,
Yeah.
it won't
Yeah,
harm.
that's why I gave oxygen.
And yes, that's correct that you gave oxygen. I'm talking about the sounds.
The sounds,
Don't get
right.
confused. Other than that, you did very well.
Okay.
Yes,
Thank you
yes.
so much.
Yeah, it's alright.
Thank you.
It's alright.
A small question.
Yeah.
If a patient is having hematemesis, wouldn't it be better to give oxygen through nasal prongs other than giving through a non-rebreather mask?
If he's vomiting, yes, that would be correct.
Yeah, because they can actually aspirate.
Yes, yes, that's actually correct.
Okay.
But like, it's not a major mistake.
Issue.
Yeah, it's not a major issue if you've done it.
Okay.
Yes, exactly.
Alright.
Begin.
This is appropriate setting already. Okay.
So Julius, you may come.
Have you been waiting for me?
Yeah.
Alright, I'm going to enter.
Okay.
Hello.
Hello.
I'm called Dr. Julius Simman. My GM's reference number is 7958207.
Okay.
I can see my patient is attached to a monitor. I will show my universal precautions. Hello, Mr. Newton. I'm called Dr. Julius. I'm here to help you. What could be the problem? Are you able to talk to me?
I can breathe.
Oh, okay. I can see my patient is a bit in distress. I am going to assess him using my ABCD protocol. Your airway seems a little bit the airway seems obstructed. I would like to give my patient adrenaline. I'll give my patient 0.5 mils of adrenaline, 1 in 1,000. Mr. Newton, I'm going to give you a small injection by your
2 minutes remaining.
How are you feeling now? Alright, Mr. Newton, don't worry, I'm here to help you.
I feel a bit better.
Alright, that's good. I can see from my monitor that my patient's respiratory rate is 20 and my oxygen saturation is 94. I'll give you some oxygen, Mr. Newton. Do you have any smoker's cough?
No, I don't smoke.
Alright, I'll give you oxygen via non-breather mask. I'll start with 10 liters, 100% oxygen. Please bear with me, Mr. Newton. How are you feeling now? Are you better?
Kind of.
Alright, Mr. Newton, I'm going to examine you. On inspection, I can see my patient's chest is moving. I'm going to palpate you a little bit, Mr. Newton. The chest expansion is good. How are you feeling, Mr. Newton?
I find it difficult to breathe again.
Don't worry, we are here to help you. Okay, I'm listening to your chest, Mr. Newton. Just bear with me. Alright, Mr. Newton, are you able to talk to me? Alright, that's good. Your airway is parted. I'm going to ask for a chest x-ray and EBGs. Alright, so I can see from my monitor that my patient's blood pressure is 107/64 and the pulse is 134. Mr. Newton, I'm going to
Move on to the next station.
I'm going to detect your pulse rate. Alright, Mr. Newton, I can see that your oxygen is dropping and your airway is not patent again. I'm going to give another dose of adrenaline. Okay, I'll give you another shot of 0.5 mils, one in 1,000. Please bear with me. How are you feeling now, Mr. Newton? Alright, good. Let's have this oxygen back. I'll now increase it to 15 liters per minute. Alright, Mr. Newton, are you there?
Yes, I'm with you.
Alright, let me reassess your chest once again. Alright, Mr. Newton, bear with me. I can see from the monitor that now the pulse rate is 134 and the blood pressure is 110/64. I'll still take your pulse. Alright, and I'll check the peripheral pulses. Alright, I can see that the temperature is I would like to see the temperature of my patient. The monitor doesn't seem to be connected.
37, it's normal temperature.
Alright, Mr. Newton, your temperature is fine. I would like now to... So, Mr. Newton, are you still there with me? Can you talk to me?
Yes.
Alright, my patient is alert and I would like to do his random blood sugar.
Blood sugar is normal.
Alright, Mr. Newton, please bear with me. How are you feeling right now?
Yeah, I'm feeling kind of bad.
That's good. Your blood pressure is dropping a little bit, 92/49. I am going to put an IV line. I'll be able to take a few blood samples. This will be the full blood count, inflammatory markers, liver function, and I'll now start I'll connect 1 liter of normal saline, 0.9%, over 30 minutes. Mr. Newton, please bear with me. Oops. Orange
Discuss the case.
Alright. I was called to attend to Mr. Newton, a 65-year-old man who got unwell 10 minutes after getting an antibiotic. On assessing him, he had an airway that seemed to be blocked, and his tongue was obstructing the airway. I suspect this should have been because of the antibiotics given. I have managed him giving him 2 doses of IM adrenaline, 1 in 1,000, 0.5 mils, a total of 1 mil. And I've also started him on fluids right now. I ordered for a chest x-ray and arterial blood gases. I'm waiting for this, and as they come, I'm going to keep him on this management, and I'll discuss with my senior. Thank you very much.
Okay, thank you. Would you like to admit him?
Oh yes.
Hmm.
So that should be the first word.
Yes.
Yeah.
Yes, okay. Would you like to do anything else regarding what happened?
Yeah, to stop the drug. I would like to stop.
He already took the antibiotics.
He already took the antibiotic.
Yes.
And it's been stopped. And
Usually, patients' allergies, like he's 57 years old, and he took co-amoxiclav. That's quite a common drug, right? So if he's allergic to amoxiclav, that should have been documented.
Oh yeah, so I need to document this.
You need to fill in an incident report of what happened.
Oh.
Yeah, because the microbiologist suggested that you give him a drug, and it should mention in his notes, definitely it should mention that he's allergic to penicillin, because he's 57 years old. And of course we know by now
that he should have had a penicillin allergy documented.
Exactly.
He's quite elderly.
This closure sentence would give you the full mark.
Full mark.
Yeah.
Okay.
No, 11 maybe, 10 maybe.
Okay, but at least a passing mark.
Yeah, definitely. To fill an incident report of what happened, as the patient's charts were interviewed before, and we're going to do we're going to perform an investigation to see how could this happen, or how did this happen. Okay, so your approach was very good. You're very calm, you're very confident.
Some improvement from the first one?
Yes, you're actually very good. Yes. But one thing is, the first time you saw the tongue swelling, you jumped right away to adrenaline.
I thought I addressed it there and then, because it's the airway is blocked.
Yes, I understand. The oxygen wasn't that low. It was not a complete blockage. I mean, you could have heard the chest did the B.
Okay.
The rule is whenever you suspect anaphylactic shock, you give adrenaline. So I say that's the best that could be done. I suspect anaphylaxis. We can verbalize that.
Okay.
That's the only point that we're missing. You said, I can see your airway obstruction. I'm gonna give you.
So I should give a reason as to why I'm going to do this.
I suspect that you are undergoing a reaction or an allergic reaction
to the medication you received.
Exactly. Your IPX is actually very good. Your IPS is very good.
That makes you not sound scripted. Because
exactly.
Now you have a reason.
Exactly.
Doing this.
Exactly.
So it's like even for acute limb ischemia, I suspect you're probably having this.
Exactly.
So I'm going to start you on heparin.
Exactly.
Okay.
So you have higher marks on IPS. It's just by saying things that you already think about.
Yeah.
See how easy it is to get to. So that's the importance. And your IPS is very good. You're verbalizing. You're interacting with the patient along the way, and you're reassessing in every step. But the transition from B to C, you felt the pulses, and then you checked the monitor, and then you saw that the oxygen saturation were a bit low. You gave the adrenaline, right? I feel that
I was
it took
actually
you
at-
some time
I
to
was at
insert the white bore cannula and to get the IV
Yeah, I
access.
forgot. What confused me is, as I was at sea,
Mm.
I had the what is it called? Is it the bell or whatever it is,
Mm.
signaling that something is happening?
Yeah, yeah.
When I looked at the saturation, it had dropped back.
Mm.
So I went back to give oxygen.
Mm.
So now when I came back, I think I lost the whole structure
Yeah.
there. So I should have when I
Given
reached
the white bore
after,
cannula.
after
You suspect
notifying
you
this-
suspect anaphylaxis from the beginning, right?
Yeah.
So what is the management of anaphylaxis?
Adrenaline,
maybe.
But they-
Anaphylactic shock.
Yeah, but they can also get
Fluids.
hypotensive. Yeah, they can get fluids.
Exactly, because it's shock. It's a type
Yeah,
of shock.
yeah.
So fluids are also very essential.
So after
Yes.
my pulses,
Mm.
and actually, I think I should first do this before I do the pulses. Oh no, I first check the pulses.
Do what?
Check the pulses.
Yes.
Check the capillary
Stop.
refill.
Exactly.
Which I forgot.
Blood pressure.
Blood pressure, capillary refill, pulses, temperature. Insert the cannula.
Yes, exactly. That's the right order.
Take off some bloods.
Exactly.
Then come and inspect the.
Take off some bloods, and give some fluids.
Give some fluid. Then
Reassess.
Reassess.
Look at the monitor directly, not to waste time.
Okay.
I'm now reassessing your response.
Mm.
I'm now looking at your oxygen saturation. I don't want you to memorize a certain sentence. Like I'm now assessing your response to the medication that I've given you.
Mm.
Or you can say, I'm now reassessing your oxygen saturation.
Mm.
Right? Just make him feel that he is involved in what's going on, and giving him like reassuring him all the way, right? So he knows that you're like you're continuously monitoring his vitals and his state, so he would be more reassured.
Okay.
Like think about it, if there is a doctor examining you and all the way, I'm now examining your oxygen, I'm now checking your oxygen, you will feel safe, right?
Yeah.
So you'll get higher marks on IPS.
Okay.
So but very, very good that you gave the adrenaline the first time you suspected. You just had to verbalize.
Verbalize that I suspect this. That's why I'm giving this.
Exactly. I suspect that you are having. You can do it. You can say it.
I suspect that you're having anaphylaxis shock, and I will administer certain drug adrenaline.
Or maybe in more layman word, an allergic reaction.
An allergic
Yeah,
reaction.
they would
Oh,
understand
yeah,
that.
yeah. Okay.
Just that, but other from that, you're actually very good.
Okay. Thank you
Yeah.
very much. Thank you. At least now I think the exposure gives you more confidence.
Yes, yes, and
The theory is really different from the practical.
And I try all the way to the examiners will not give you any response. They will just be like that,
Looking at you.
not even looking at you. Maybe looking at you, but you will not notice it. He will be sitting behind you in the exam, right? And he will not do anything. And if you look at him, that's the biggest mistake that you can do. If you look at him before the 2 minutes bill, if you like do some and then look at him to wait for a result, that's a very big mistake. If there is something, he will tell you. If he doesn't tell you,
Proceed.
and then you should know it by the examination you do. So you're auscultating, right? Don't look at him. If he tells you something, then he should tell you something. If he doesn't say something, then you should know what you're listening to exactly.
Okay.
You know what I'm saying?
Yes.
I say good.
Okay.
Yes, yes.
Thank you. Thank you.
You just the things that you delayed the IV cannula.
Cannula, yes.
Routine blood tests wouldn't have been very
Very
important.
important in anaphylaxis.
To get more marks, you should mention, I'm gonna admit the patient to the
With the
ICU.
patient, I need to fill an incident form.
Exactly, incident form, and perform an investigation of why did this patient receive a drug that he is allergic to.
Yeah.
That's that.
Thank you.
Is there any question?
No.
Okay, very good.
Expectations met for the feedback. Yeah, I take it positively. Thank you. Thank you.
Yeah, I wish you all the best.
All right. Thank you.
Keep going, keep going. You're doing good.
Thank you. Are these drugs normally easily labeled? I struggled to find adrenaline.
No, in the exam it will be obvious.
Okay.
You just have to open the right charts. Remember that A, B, C.
Yeah, A, B, C.
Exactly.
No, A, B, C, D. Then, oh, there is no E. It's A, B, C, D.
The first one is A, B. Second one would be mostly fluids.
Fluids,
And then
saturation.
C,
then
circulation, drugs, and the third one.
Okay. All right. All right. Thank you very much.
You're welcome. So Ahmed is the last one, right?
Yeah.
Okay, Ahmed, prepare. I'm picking a scenario for you to do right now. Okay, Ahmed, you may begin.
Begin.
Hello, I'm Dr. Ahmed, one of the doctors here. Are you Mr. Newcomb? Mr. Newcomb?
Patient can talk back.
Okay. I will start assessing my patient. Mr. Newcomb, I will check your first.
Very speedy.
Okay. So I will check the saturation. I will connect the patient to the monitor because I cannot see the heart rate. The saturation is very low, 75. So I will put the patient on ventilator mask, 15 liter per minute. Mr. Newcomb, are you better now? Okay, I will. I can see you have shortness of breath. Yeah, wonderful. For now, I complete the assessment. Sure. Examine your chest. See if there is you have any pain.
No pain.
Start tapping on your chest.
Normal sound.
Okay. I will see also the symmetry for the chest. Okay.
Symmetrical.
I will hear your chest now, Mr. Newcomb. Okay, Mr. Newcomb, I can hear some noises in your chest. That's why now I will give you nebulizer. Okay, I will change the noise.
What will you give? Assume you give.
Nebulizer, yes, salbutamol 5 milligram. Nebulizer. Okay, but I don't know where they put it. It's not here. Okay,
Assume done.
Mr. Newcomb, how do you feel now?
I still can't breathe.
Okay, I will continue my assessment.
Still can't breathe.
Yeah, I will assess now your capillary fill. I will press on your fingers on both sides.
Normal.
Okay, I will feel your pulse also on both sides. I can feel pulse. Okay, I will check now for blood pressure. Blood pressure is very high, and the saturation is still low, and your pulse also is very high. So, Mr. Newcomb, I will give you now another nebulization with salbutamol 5 milligram, and I will add ipratropium bromide 500 microgram also.
Thank you.
Okay, so how do you feel now, Mr. Newcomb?
I'm feeling better.
Okay, I will continue my assessment. I will make chest X-ray and EBG and ECG also for you. Also, I will insert cannula. Okay, I will start to give you also hydrocortisone 100 milligram because I am suspecting you have a severe case of asthma attack. Okay.
How are you gonna give it?
IV. Yeah. So, how are you feeling now? So saturation is now improving. Still the pulse is high, the blood pressure also is very high. Okay. Okay, I will continue examination of Mr. Newcomb.
Session कर रहा है.
I will expose you below waist. I will check the abdomen. Inspect the abdomen. Any pain, Mr. Newcomb?
2 minutes
No
remaining.
pain.
Okay, I will hear also the bowel.
No normal sounds.
Okay, I will examine also your legs for pulses.
Normal. Normal pulse.
Okay, I will really assess you, check saturation.
Normal legs.
Okay, so I will assess your pulse is still at a bit high, your saturation is improving, your blood pressure also is decreasing, approaching to normal. How are you feeling now, Mr. Newcomb?
I'm feeling much better actually.
Okay.
Thank you very much, doctor.
Okay, you are welcome. Okay, Mr. Newcomb, could you tell me about what happened to you today? What happened before
I
this?
don't know. I was out with my family
Yeah,
in the garden. We were
Yeah.
playing,
yeah,
and suddenly I started having shortness of breath.
yeah. And
That's what happened.
yeah, and do you have any medical conditions like any lung problems or asthma before?
Yeah, I have a history For asthma, yeah. I take an inhaler.
Yeah.
Yeah.
Are you taking regularly every day?
I've been missing it out. I've been missing a bit of doses actually recently.
Yeah.
You can discuss your case right now.
Yeah, okay. So, Mr. Newcomb, 32 years old, come to the ER with severe shortness of breath and coughing. And after examination, I found there is wheezes in the chest. So I give him nebulizations. I give him 2 sets, one with salbutamol, another with salbutamol and ipratropium. Also, I gave him hydrocortisone 100 milligram intravenous. Then he started to improve.
Move on to the next station.
And the respiratory. There is one thing I missed, the D. Yeah, maybe from the panic and from the...
Yes, it's alright. You did very well. Okay, continue.
The temperature and the Glasgow scale and the blood sugar.
What did you give him?
I give him hydrocortisone 100 milligram IV. I give him 2 sets nebulizer, one with salbutamol 5 milligram, other salbutamol 5 with ipratropium when he started to improve.
Okay.
I gonna...
What would you like to do with him right now?
Yeah, I gonna discuss with my senior and I'm gonna admit this patient for frequent nebulization, for frequent also hydrocortisone, for close monitoring.
Okay.
Yeah, and then we will, after discharge, we will refer him to asthma clinic also to monitor for his medication.
Thank you.
And, yeah.
So you did very well. Very well. Yeah. 2 problems only. 2 problems. The first one is actually I'm very glad with your performance right now. But the first problem is you make an assessment, you make it very good. You make an intervention and then you always wait for a response. That wastes time. You don't want to do that. You want to make the intervention. Before you make the intervention, tell the patient you were doing that, which was good. I'm going to give you oxygen. Interpersonal skills, very good. I'm going to give you oxygen to improve your breathing. Okay? And then in the meanwhile, I'm gonna continue your assessment. Don't look at the monitor right away. Okay? That's gonna waste time because the response will always gonna take time. They have actually on the machine, on the monitor, they have a way, when you give the oxygen, they have a method that they say to the monitor, improve after 20 seconds.
So I will assess the next.
Yeah.
So after giving,
It's already improved, but only after 20 seconds. So you're just wasting 20 seconds waiting it to improve.
so you just move.
So I will move to
Yes.
next.
After you do the next assessment,
Then you go back.
exactly.
So that's the purpose, another purpose of going back.
Exactly, to see if you've done the right thing.
Because the 20 seconds will have elapsed anyway.
Exactly. So use the 20 seconds. They actually have this in the monitor. They can say oxygen saturation rise within 20 seconds.
So that's the reason why I reached C and the patient
Deteriorated
deteriorated.
again. Because,
So if I had waited and waited, you're wasting time.
yes,
Yet here now you go back and reassess.
exactly. The patient improved. The patient improved initially after the first dose, but then he deteriorated again. The shock is more severe, so you're gonna give him another dose. Let's just continue with Ahmed, and then I'm gonna get back to you. Okay. So that's an issue. You did that in airway, and you did that in breathing. When you gave the salbutamol, you can actually use this time to make a perfect C. Yes, I'm gonna give you nebulized salbutamol 5 mgs driven by oxygen. These minor details they match.
They show that.
Yeah, if he's a COPD patient, driven by air, room temperature, because you don't want to give him high flow oxygen or low flow oxygen.
Oh.
Yes. If it's an asthma patient, driven by high flow oxygen.
Driven by oxygen, driven by air.
Yes.
Can I think you're supposed to also show that you're connecting the nebulizer, right?
He did that.
Yeah.
He did it. He couldn't find the nebulizer, so we moved on. I think it's in the third drawer. Someone misplaced it.
Sorry for interruption. Abdullah, how are you going?
How are you going? How am I going?
So
Where?
are you going to Salford or are you gonna?
Salford, yeah.
Okay.
I'm gonna go by bus. It's alright. What?
So this is your last station.
Yeah, I've
If
finished.
you want, I can drop you.
No, it's alright. It's alright. Thank you.
Well, I'm going to drop Dr. Ikra.
Where are you heading exactly?
It's, I don't know exactly what. Carlton Road.
In which area?
Yes.
No. I'm just gonna take the bus. It's all right. Thank you very much, doctor.
Do you have Umar's number?
Whose number?
Umar.
Omar?
Yeah, Umar.
Amr.
No, Umar.
Who's Omar?
He is a maintenance guy.
No, I don't know about Omar.
So you need to have the number of Umar.
Okay, give me the number of Omar.
So the mask, you change the whole mask or you only change this piece to deliver the salbutamol in?
No, you actually put the salbutamol in this here, and then you close it.
You put it actually?
You can try to get it out, yeah, for the sake of
So
the exam.
you change that. Put
Okay,
this.
so-
This will already be attached
Oh, okay, I get it.
as a nebulizer.
Yeah,
mask.
it can
That's-
be. It comes in a separate pack, by the way.
In
That's
the exam
separate-
setting?
No, in the actual practice.
Yeah.
Okay? So it's a separate. This is separate. Okay. These are separate packs, as in here. Okay. So this separate. You assemble whatever you need. Okay. It may be the case in your exam as well.
Mm.
Shall I turn that off? The laptop.
Yes, we finished.
Yeah.
Yeah, we finished.
Yes.
So Ahmed, so that's a very important thing.
Salbutamol just
You get all tape, right?
Not fluid.
Exactly.
When I saw blood pressure very high, I was going to give something for.
You can do so.